Hi, I'm Katie Schubert, President and CEO of the Society for Women's Health Research. I'm joined today by Dr. Jasmine Johnson, a third-year maternal-fetal medicine fellow and clinical instructor at the University of North Carolina Department of Obstetrics and Gynecology. We're so thrilled to have you here, Dr. Johnson. Thanks for joining us. What is the impact of COVID-19? What is it having on maternal and fetal health broadly? What do we know? What do we not know?
Yeah, so broadly, we know that women who get infected with COVID-19 in pregnancy have a higher rate of hospitalization compared to non-pregnant individuals, a higher rate of ICU admission, and a higher rate of intubation. And so pregnancy is a high-risk category, and the CDC treats it as such. And so we know that COVID-19 in pregnancy is risky. And it can be adverse outcomes for mom and baby when we think about risk of preterm birth, risk of C-section. And then when we think about disparities, we know that communities of color, again, just like everything else, are disproportionately affected by COVID-19. In particular, in my practice, our Latinx community is getting hit particularly hard. My father's a physician. He takes care, all of his COVID patients have been incarcerated. And so these vulnerable populations are getting hit the hardest, in addition to, the complexity of being pregnant with COVID and that risk that it also incurs.
Yeah, I think to that point, knowing that COVID does have disproportionate impacts on certain populations, but also knowing that, maybe those populations haven't been included in the research leading up to a COVID-19 vaccine. Are there steps that we could be taking to ensure that pregnant individuals are appropriately and safely represented in that type of research?
It's a great question. And I think that COVID has highlighted a flaw in the system that, obviously has been something that we've been hoping to change for a long time. As someone who serves on the Health Policy and Advocacy Committee for Society for Maternal-Fetal Medicine, one of the things that we have frequently written to our legislators about and our policymakers is that we want pregnant and lactating women to be included in studies when it comes to not just COVID-19 vaccination, but medications. It has been a barrier and can be a really big challenge when you're trying to provide complex medical care, just because the data isn't there. So it's not so much that it's not safe, but we just don't know, and we can't provide the reassurance that we would want to.
Yeah, absolutely. As a healthcare worker, I know the last 8 months have been challenging, but I wonder how the global health pandemic has been affecting your work in particular, and then, of course, your life more broadly. What does that look like in the past 8 months?
Oh my gosh, this is like the year of eternity. But I would say, the first initial big change was the switch to remote prenatal care and telemedicine. And I think that that's something that our institution did pretty well. But again, we think about populations that may not have access to reliable internet or reliable phones. And although telehealth allows us to reach more rural populations, their own kind of social determinants of health that sometimes even limit us from a telehealth standpoint. And so I would say that was the biggest change, in addition to the PPE that we wear all the time, becoming just, it's just another part of our body at this point. And that has been something that I'm grateful that we've had the PPE we've needed. But also just the pregnancy experience for patients has changed in that, so the number of support people you can have with you, whether or not your support person can be with you during your visits, it has become very isolating. And I think that for patients that don't feel that self-agency to be able to speak up and say what they need at that time, or if something's bothering them, or if they have a question, it can be really hard to be in visits alone, and sometimes more intimidating than if you had a partner there. And so we need to be more mindful about that as clinicians. And I think people are doing a good job of recognizing that. And then you just think about all of the social things that change. One of the things that our patients have to deal with, that a lot of patients don't is like, you don't get to have your baby shower, or like the things that make pregnancy enjoyable despite like having a complex pregnancy. And so all of those things kind of play into my day-to-day practice. You think we are just managing the medical things, but there's also this like social aspect that we share with our patients too. And then from a personal standpoint, navigating having two children and a global pandemic, and what does that mean, and not having family support close by. So we're all feeling it, and we are all really encouraged by the vaccine, and hopefully that means that things are going to change for the better soon.
Yeah. Well, and to that point too, I think the $1,000,000 question for everyone, knowing that we're talking about this, to the end of December 2020, and we're seeing sort of the first vaccines come out and the frontline healthcare workers receiving them. Have you gotten yours? Or if you haven't, are you planning to get it? And then why, and sort of what considerations did you make?
So I haven't gotten it yet. I do have my appointment scheduled. And in making the decision to get the vaccine, I really had to also go back and research like how vaccines are made and make sure that I felt like my questions were answered. And so it's not so much the asking of questions that is the problem, but it's just making sure that you have unbiased, reputable sources for your information. And so things that factored into whether or not I chose to get the vaccine, obviously my family, and making sure that I'm able to do whatever it takes to keep them safe, but also the fact that I am still seeing a lot of patients that have COVID-19, and I'm concerned for my safety as well. And so if there is anything that we can do to not only protect ourselves, but protect those around us, it was a no-brainer for me and a lot of my colleagues.